New grad nurses, listen up. I don't know if they taught you this in nursing school. I didn't learn this in nursing school, or if I did, I certainly didn't remember it. How to tell what size your IV is. So peripheral IVs all have a certain color, and it's a universal color to determine what size the gauge is, and that is something that you need to know in report. That is something that you need to know when you're giving certain medications and fluids, etc. And looking at it, you don't need to see what's written on it. You can tell just by the color. Your 14 gauge is orange. Your 16 gauge is gray. Your 18 gauge is green. Your 20 gauge is pink. Your 22 gauge is blue. And your 24 gauge is yellow. I did not know that when I was a new grad nurse, and not always does somebody who dresses the IV, do they write what gauge it is. You should. It should be charted, but you get busy, things happen. It's not always charted. So looking at the catheter, you do not need to know, you do not need someone to tell you what size catheter it is. You can look just based on the color. So those are your common IV catheter sizes and what color they represent. And that is something that you should try to remember, especially if you work in something such as ER, ICU. But even if you work on the floor as a new nurse, you should know what color the gauges represent and what that means. And pro tip, the higher the number, the smaller the catheter. So it's almost backwards. You would think that a 24 gauge is bigger, but a 24 gauge is actually one of your smallest IVs. So your 14 and 16 gauge IVs are going to be your large bore IVs where you can do massive transfusions, you can do rapid fluid installation, etc. And then most patients are going to have 18 gauge or a 20 gauge, so a green or a pink. And those are your common gauges that you can give fluids through, IV medications, etc. And then your 22 gauge, you still can give things through, but it's a smaller catheter, so you have to be wise that if you have patients with smaller veins, you're probably not going to be able to put a 14 or a 16 gauge in a small vein. So just food for thought. And then your 24 gauges are more your pediatrics and your infants, and then you can also have a 26 gauge, which is a neonate. So food for thought. Just keep that in mind when you're a new nurse. That can kind of help you kind of plan your patient's care. That can kind of just help with your assessment skills, and it's a good thing to know.